We commonly encounter bacterial infections in the ICU, but occasionally we see viral infections also in the ICU. I have privilege of interviewing Dr. Rajesh Chawla. Dr. Rajesh Chawla is Senior Consultant Pulmonology and Critical Care at Indraprasth Apollo Hospital. Dr. Rajesh Chawla is the brain behind this course. Dr. Rajesh Chawla is Chief Coordinator and Moderator Critical Care Infectious Disease E-Course. What are the common respiratory viruses which are present in the ICU?
See, patient with viral infection do present in the ICU. They could be respiratory viruses, there could be CNS viruses, there could be viral myocarditis because of viruses, even the gastroenteritis could be because of viruses. An immunocompromised patient, there are like CMV, these patients could also present in the ICU. Now, as you asked, the respiratory viruses, influenza A and B are the commonest viruses which present in the ICU. Parainfluenza, adenovirus, metapneumovirus and the coronavirus, rhinovirus. These are the common viruses which can result in a serious illness and present in the ICU. Then in immunocompromised patient or in an immunocompetent patient who has been staying in the ICU for a long time, CMV, varicella zoster virus, the HSV, they can also cause illness and present in the ICU.
When will you suspect H1N1 pneumonia in an ICU patient?
You know, H1N1 of course has become common. It was a pandemic and now it presents as a seasonal infection. But you know, depending on if you are seeing in your region the influenza virus, particularly in winter, patient has got a fever, cough, these patients usually will be treated by a general physician. They will only present in the ICU if you get a respiratory symptoms. They have a bilateral shadows, respiratory symptom with a symptom suggestive of influenza. You should suspect H1N1 and you should test for H1N1 in these patients.
When are these patients admitted to the ICU?
You know, these patients will be admitted in the ICU if there is a severe physiological derangement. Like patient is very dyspneic, his respiratory rate is very high, his hypoxemic, and these are the major indication of their admission in the ICU, because H1N1 most of the time will present as a single organ failure. So respiratory